Okay, it's 6 o'clock, so shall we make a start? I hope everyone can see and hear me okay. My name is Rob Cordwell. I'm a GP in Southport, and I'm chair of NHS Southport CCG. So welcome to this event. I'm just going to say a few words by way of introduction, and then we'll move on to our programme and our speakers. If I could just do some housekeeping first, if I could ask everybody to stay on mute and turn their cameras off while the presentations are taking place. We are recording the event today so that it can be put up on the website and interested people can have a look at it. There will be an opportunity to ask questions. So we would ask that the speakers aren't interrupted while they're in their presentation. If you use the hand or the chat function, and then we will get to you once the presentation's over. If there are a lot of questions and we won't have time or we don't get to you, then we will pick up with you any questions by email or by phone. So please do ask, and we will get back to you one way or the other. Next slide, please. Okay, as I said, there isn't going to be a formal question and answer session at the end, so we're asking for questions at the end of each presentation pertinent to that. If you do think of any questions after that or this evening or whenever, then there's an email address up on the screen there, which if you email in there, we will get back to you and we will respond. And there is a subtitles function on Teams. That's on the 3 dots up at the right of the screen, and it's referred to as live captions. So anybody that needs to use that, please do, and we'll see what sort of amusing mistakes it can make with some of our possibly medical words. It does tend to work quite well, I think. Next slide. Okay, so this is the plan for this evening. I've introduced myself and this is the introduction section, and then we'll be moving on to Fiona Taylor, who's the Chief Officer of our CCG, who will give an overview of our year and some of our successes. Martin Mcdowell, who's our Chief Finance Officer, will then go through our performance over the last year, and then we're back to Fiona for an update of where we are now and where we're going over the next year and longer. We've then got Eleanor Moulton from Sefton Council, who will talk to us about the future of health and care in Sefton. And then we've got a session on general practice, which Jan Leonard, our Director of Place, is going to lead, which is an interactive session. There'll be breakout groups and an opportunity for some good discussion, hopefully, on where general practice is now and where it's going. Okay, so we have a poll question. This should come up on your screens, and we just invite you to click on your answer, and then we should get real-time answers. So this is to test out the functionality more than anything else. So if we can go ahead with the poll. Okay, and I've just realised you have to tick the polls button, which is at the top. It's a little box with a circle and a square in it, and the poll will then come up on the sidebar.
Don't get anything like that.
It's next to the 3 dots. It's in the top right. Oh, and now it's popped up on the screen. So can everybody see that now?
No. And the only 3 dots I've got are at the bottom, which is more actions, and it's not on there.
It might be in the chat box function.
That's not appearing at the moment either.
We did have this issue last week, Chair, with some functionality on certain people's computers or iPads. It can
depend how you're accessing Teams.
I'm using Windows 10 on our PC, so
It's in the bubble chat box. Somebody's just...
Yeah, it normally does appear, but it's not appearing in this thing. I mean, I use it every week, several times a week, but it's just not here. All I've got is show participants and raise hand.
It's strange.
Suggestion might be just to go out and come back in.
Log back in, yeah.
Could try that.
Yep.
Won't make any difference to Teams, so I'll do that. You carry on. Never mind me.
Okay. Okay, so we've got some responses here. The poll has been put back on. Okay, and that looks to be working. Hopefully, the gentleman can get that working for him as well. So majority of people here have been invited, and then there's a couple of others. We've had 15 responses, and I'm not sure how many people are actually. 29 attendees, but some of those are CCG staff.
I haven't got that back either.
Okay. Any other suggestions? I'm not sure we can. If there's anything on our end we can change.
I'm not sure that there is, Chair, but
Okay.
what if there are a few people that are indicating they can't take part in the poll? If you make a note of what you would respond, and it's not statistically significant, it's just to break up the procedures, if you like, and get a bit of interactivity apart from the rooms that we're going to put people in. So if people feel they want to collect that, but we'll try as we go along to make sure that we've got your, if you like, vote, and we'll have to do that in a different way for you. When you get into the room with your facilitator later on, if you just want to capture, and we'll make a note of that. If you can't see them, Laura's put in the chat box answers to comms, so hopefully people can see the chat box.
Okay, that's great. So we've got that poll now. So I'll move on. I'll hand over to Fiona for our year and successes. If I can just remind everybody to mute themselves and be off camera while the speakers are presenting. Thank you.
Thank you. Hopefully I'm now on camera. I was speaking behind a camera but not hiding. So welcome everybody. As the chair has said, I'm Fiona Taylor, very proud to be the Chief Officer of Southport and Formby CCG. We've moved the slide on, please. Noticing the obvious mistake there that I do 2 CCGs. Some of our achievements for this last 12 months. So we are looking back in this section of the agenda to 21-22. And one of the things that I wanted to say really is I sat here last year behind a camera and was hoping that 12 months on things would be different and we would be, if you like, in the flesh, but that's not been possible. We're still advising everybody to be cautious, even though we've got vaccination campaign, which John will go into in a little bit more detail. So just a quick plug from me, remember hands, face and space, everybody. So in the 12 months that we've been dealing with the pandemic, because it hit just before the end of last financial year, it's been a lot more intense than probably when I spoke to you last year. It's continued. Obviously everybody's very well aware of what's been in the media. And we've been behind the scenes in CCG supporting the system in order that we can ensure that those of you who needed the services and the work that we've been doing in the pandemic has been able to be delivered to all of our residents and make sure those most vulnerable have been kept safe. We've done a lot of work with our community voluntary faith sector and our emerging primary care networks, particularly in the space of the vaccine programme. And you can see on the bottom right hand corner of the slides, if we were to translate all the work that the volunteers did and, you know, paid that in cash, we would have paid a bill of about £81,500 in Sefton. So a tremendous work from our volunteers, and a huge thank you. I went back onto the front line doing vaccinations. I did have some training, but was working alongside volunteers who just came out of nowhere, and we actually had coordination with CVS. So thank you to everybody. Vaccination programmes, we've managed to, out of our Southport and Formby residents, so that 125,500 is just Southport and Formby CCG. 86 and just over 86,500 have had first doses, and 80, just short of 80,500 have had the second doses. And of course, we're now working with our younger cohort and offering pop-up services in the form of a bus, or down at Seaforth and Litherland we've got a walk-in service for our younger population, and we'll be getting them ready, as Jan will tell you, for our booster campaign. Next slide, please. We produced our plan, Sefton Together. Many of you, I can see that came on camera and then went off as we asked you to go off camera. Are very familiar to our work in Southport and Formby and have participated, or even in South Sefton, some of you. And we were pleased to start to build up the plan as best we could, given the pandemic, and start to deliver some of those things across our system. Some of you will see Suzanne, because she will be facilitating a group, but one of the most proud moments, it's like I'd got 10 of them, was when I found out from Suzanne, because it's all hush hush, that she'd actually been nominated and awarded an MBE in the New Year's Honours list. And there was also a shortlist for the Parliamentary Awards within the CCG this year. We retained our highest rating for the public engagement that we do, and I think it's been very different this last 18 months. I personally like a lot of interaction with you guys, and that's been limited because of the pandemic, and obviously as soon as we can do more face-to-face interactions, we will aim to do that. But nevertheless, we still maintain the work that we do, and thank you to all of our colleagues in Health Watch, in our patient public engagement group, Dill Daly, our lay member for patient public engagement in the CCG, and for all those members of the comms team that support comms and engagement. One of the huge successes out of the pandemic was the development of support with the care homes. Many of you will have seen the media coverage of the care home situation from some of our most vulnerable citizens in our communities, and we've worked really closely with the local authority to build the work with and relationships with our care homes, and make sure that our residents that reside in those establishments have got the best coordinated care that we as statutory organisations and others can provide. So quite proud of that work in that space, and that continues actually in terms of the work we're doing with care homes. Next slide, please. So during 2021, with the restrictions that we've got, we did have a virtual AGM last year. We have been working alongside partners, as I've just outlined in some of the achievements, and we have been working with our colleagues at Southport and Formby Hospital and West Lancashire CCG in terms of engagement around particularly the services of acute care within Southport and Formby, but very much trying to focus on the out of hospital work and support that of acute care. We've also as well been working on improving language services in general practice and moving to a single approach across the borough instead of having a variety of different contracts to provide that language support in general practice. Next slide. Our year comes with challenges as well as opportunities, and as I think I started off by saying, a huge thank you to everybody. The challenge of COVID-19 is still with us, and it's our role in services and as communities to try and normalise our life around living with COVID-19, but it is for many people understandably a huge challenge to their day-to-day living, and as a CCG we are attempting behind the scenes to continue to make sure that those vaccination programmes and anything that is needed from government is provided through a commission service locally. The CCG, we've had very different financial arrangements this last 12 months, and the CCG has risen to the financial challenge. Martin will be telling you a little bit more about that, but the underlying financial challenges are still there within the CCG's budgets. General practice, there's a lot of cover of general practice, and all our practices have been open all the way through the pandemic. Maybe the doors have been shut because of infection prevention control measures that have had to be put in, but across the system, right from primary care through community services, acute services, there is significant pressure on the system in the NHS and in social care services, and we are still working very closely with colleagues to ensure that we, for your benefit, get back to normality, but that is going to take us some time. Martin will give you some performance details as we've been asked a specific question, which will cover some of the what we call restoration work, but there's no doubt that the system is under significant pressure. And as I said earlier, we would have liked to have engaged further and more fully, and if there's any comments on that, we would be really open to your critique and suggestions. Thank you. So, what have we been thinking about? We've been thinking about how we, as a CCG with the system, adopt one vision for the Borough of Sefton as we move forward into the next 12 months and beyond. And we've adopted the Health and Wellbeing Board vision. I think many of you will see this, and when Ellie does her presentation, she will continue on with this theme. But our whole raison d'etre is to make sure we've got a borough that's confident and connected, and that we start well, live well, age well, also make sure our end of life care is really good, and make sure that where everybody has a fair chance, positive and healthier future, and where we attempt to improve health outcomes and reduce health inequalities. Next slide. Our partners, I've mentioned some, but we have a wide range of both statutory, so that's my health partners in the NHS who are listed there, the new emergent primary care networks, the federations that are GPs coming together to provide services, our huge and really, really sound voluntary community and faith sector across Sefton, and some of the work that we do in the interface with our Lancashire colleagues in West Lancashire, and then the two healthcare partnerships across Cheshire and Mersey. And in last year, we worked with Lancashire and South Cumbria and NHS Foundation Trust, who did have the community contract for community services like district nursing. That's now with Mersey Care since middle of last financial year that we're talking about. Next slide. So I'm going to finish my bit there, and I'm going to pass you over to Martin to continue the conversation about performance. Thank you, Martin.
Thank you, Fiona. So I'm Martin Mcdowell. I'm the Chief Finance Officer at Southport and Formby CCG. I'd just like to share with you some of the headlines around our performance for the 2021 financial year. Firstly, if we could just go back a slide. Okay, thank you. Yeah, if we can move on, the first slide is how we spent our money. So sorry about that. So what you can see is a pie chart that indicates how the CCG spent all of its money. So 47% of our funding went on acute services, 10% on community services, 9% on continuing care, 9% on mental health expenditure. Some of those areas overlap, so that's not a clear sort of boundary in terms of some of the spend. Some of the continuing care spend will be related to mental health as well. 10% of our budget was spent on primary care, 11% on prescribing, then 4% on programme cost support and various initiatives that we've started over the years. And then finally, just in terms of the running costs, so our administration budget is around 1% of our overall allocation, and we are sort of set up to live within a specific allowance, which we often do, and we've discharged that particular duty every year. Next slide, please. So in terms of our performance, our budget overall was £245 million. That equates to £1,951,000 for each Southport and Formby resident. In terms of the end of the year, the CCG reported a break-even position for the 2021 financial year. This was an improvement from a significant deficit we reported in 1920, largely driven by the response to COVID. So we did receive additional COVID funding, which addressed a number of pressures that started to emerge during the year. And then the CCG's external auditors issued an unqualified opinion on our annual report and accounts. So there's two aspects to that. Firstly, we spent our money in the way that we intended to spend our money. And also secondly, in spending our money, we achieved value for money for the taxpayers as well, in terms of the efficiency that we achieved through that particular expenditure. Next slide, please. So in terms of improving performance, we obviously continually strive to improve our services. Some of the areas of good performance for the year that we are reporting back in, 2021, included the progress we made to restore our elective services. So where you are sent to hospital by a doctor, 74.4% of our population were treated within 18 weeks. And that was 10% higher than the experience at a national level. We met some important mental health targets, so they were achieved, particularly around responding to first episode of psychosis and also follow-up after inpatient admission. 50.4% of our residents accessing the IAP service, the Talking Therapy service, reported recovery through treatment, and that compares to a target of 50%. And then our cancer 31-day treatment target was also achieved, 96.2% compared to a target of 96%. Now, just before I invite questions, I'm conscious we have had a question in from Mr. Jeff Gaskin. So if I read the question out, and I will just respond accordingly. So Jeff's asked the question: we are told by the media there is considerable backlog in medical procedures, operations and specialist appointments. What is the current position in Sefton and how is this going to be managed? So in terms of answering that question, just a little bit of background. The referral to treatment constitutional target is that 92% of patients referred should have their treatment completed within 18 weeks of that referral. That particular target was last delivered at a national level in February 2016 and had proven to be a difficult target to achieve. So the targets are set at individual CCG level rather than borough level. So the figures I'm about to talk to relate to Southport and Formby only. Jeff, we can provide South Sefton figures if you need the wider answer, if you want to follow that up with through the comms team. So our CCG last met the constitutional target in July 2019, and we have a good track record in terms of providing access for elective care. So in terms of patients who have been referred but yet to complete the pathways, the CCG's pre-pandemic level peaked in February 2020 when we had 9,618 patients who are currently involved in an active pathway. What we observed is that referrals to secondary care services dropped during 2021 as the pandemic and lockdown was in place. And by the end of March 2021, we had 9,036 patients receiving treatment, but yet to complete their pathway. In terms of the most recent position reported to the CCG board, that's identified that this figure has increased significantly to 12,290 patients in June. We also reported in June that 79.2% of the patients who completed treatment completed their treatment within the 18-week target. And again, this compares favourably with the national position of 68.8%. So one of the things that has attracted attention as well, which has been unusual for the NHS in recent years, has been the extremely long wait position. So we now have a number of people who've been waiting longer than 52 weeks. So whilst the overall numbers have increased between March and June this year, the focus on the long waiters has proven successful. So we had 335 people waiting at the end of June 2021, which compared with 519 at the end of March 2021. And our patients who have waited longest will continue to be prioritised to reduce this number further over the next few months. And again, the CCG compares favourably with the national position. Our long waiters constitute 2.7% of our total list, compared to 5.6% nationally. In terms of how this is going to be managed, we're working very closely with providers to ensure that patients remain safe while waiting for their treatment to be completed, and that they encounter no adverse harm as a consequence of delayed treatment. Additional funding has been announced to support the reduction in backlog, and that announcement was last week, and specifically £1 billion nationally will be made available between October 21 and March 22 to address the issues, and we're waiting guidance on how this will be deployed. I think finally for me, and my clinical colleagues might want to pick this up either through now or through the agenda, we would continue to stress that anyone feeling poorly or feeling as though they do need a referral into hospital, they shouldn't delay their treatment, and they should continue to access services in the way that they would have done before the pandemic. So again, that will turn up, I think, as part of a theme in our presentation today. So if I just pause there and invite any other questions.
Okay, thank you, Martin, for that. Any questions from anyone with us? Okay, and I think in terms of Martin's last comment, I would just add patients who are being referred, are being prioritised. So there are long waits, but it doesn't mean that if you have something that you're worried about, you shouldn't go to your GP and be referred if that's appropriate. And as we're working through that backlog, there's going to be a lot of work at prioritising and making sure that those backlogs are processed and patients are seen quickly where the clinical need is there in terms of avoiding any harms or anything. So please don't be dissuaded because there are long waits. You still should obviously seek advice and help, anything you're concerned about. Okay, if we move on to the next slide then, please. Okay, so we're back to Fiona now with a presentation where we are now and where we're going. I'll hand over to Fiona. Thank you.
Thank you, Chair. I've just put a couple of things in the chat box for our public, that we have had 4 questions. Martin's just answered one, and the others will be picked up because they fitted quite nicely into presentation. And then we will be responding in writing to the person who's asked the questions, and all the materials will be available on the website after this evening, as well as a recording. So where we are now and where we are going. So I guess in another 7-8 months, the landscape, so what it all looks like locally, will be different. And for some people, that will be of concern. And we've been working hard in Sefton to make sure all the work that we've been doing over a number of years is pulled together and is the firm foundation for our future. My job with the team and the governing body and our partners like Healthwatch and, as I said before, community voluntary faith sector and others, is to make sure that Sefton is in a sound position to work in what we call a new landscape, so how it looks across the NHS. And to that end, we've got two things going on. So there's the development of the, I'm just getting a bit of background noise if somebody's not on mute. We've got the wider Cheshire and Mersey integrated care system that recently, with the publication of the bill in July, has been called an integrated care board. So just some slight change there. That integrated care board is the board that will have oversight of all the NHS funding that comes into Cheshire and Merseyside that currently sits in the CCGs. And it also have some aspects of specialised commissioning. So it's really important that we are clear how we want to interrelate with the Integrated Care Board in Sefton. To that end, we've been working, as I say, hard in what they're now calling place-based partnerships. We've been calling it the Integrated Care Partnership. But at the beginning of July, when the bill was published, they've now taken the Integrated Care Partnership name, and they're going to use that alongside the Integrated Care Board at Cheshire and Mersey level. So what you'll have is an Integrated Care Board that's the NHS funding, working alongside an Integrated Care Partnership at Cheshire and Mersey level, and those two will work, one will work on planning, the other will work on strategy, and they will work hand in glove together to make sure across Cheshire and Mersey the aims of reducing the health inequalities and improving the health outcomes, spending the money wisely, is achieved for and in tandem with the 9 places, of which Sefton Borough is one of those place-based partnerships. And Ellie's going to talk a little bit more about that in her presentation. So the Borough of Sefton is the place at which we route everything back and focus on our communities. We've been working with newly emergent primary care networks who will take up their provider function as GPs. We're working, as I say, with our community voluntary faith sector, our other providers that were listed on that previous slide, to ensure that we can continue on our improvement journey. So yeah, things are changing. In 2022, it's subject to parliamentary procedures. The proposal is that we have this new system for the NHS, and our focus has been very much building on the work in the Borough of Sefton. Next slide, please. You'll be familiar with this map if you live in Sefton. Top of the patch is the top end of Southport, bottom end of the patch is down Bootle. And what we're trying to depict on this is the 3 primary care networks. So the primary care network up the North Southport and Formby PCN from the 1st of April. And then there are 2 PCNs that cover the areas of Bootle, Crosby and Maghull. And then the other one for South Sefton is Seaforth and Litherland. And what's really significant for us in Sefton is that those 3 primary care networks, or PCNs, are being led by 3 experienced clinicians. That's not the case in everywhere in England, but we've really been able to build upon the last 9 years of clinical leadership in the CCG. So the primary care networks, as I said before, are deliverers of care. Then they're not going to be acting in a commissioning role. But what's going to be different is that for many years, and I've been around the NHS quite a while, it'll be 40 years next year, we've had commissioning and provision together, then it was split up. The aims of the reforms this time are to ensure that we're working cohesively and collaboratively together, and that the spend on Sefton, the Sefton pound, is spent with everybody thinking about how we can work that in an integrated way. Now, you guys know Sefton better than I do. I mean, I've worked here for 15 years. I am not a resident, and the best people who understand Sefton are the people who live in the borough, and that's very much at the premise of what we've tried to do as CCG, which is making sure that we listen and respond to residents, but we base our commissioning decisions on the need of our population. So one of the things that we really are focused on is something called a JSNA, or a Joint Strategic Needs Assessment, and that's one of the functions, statutory functions in law, of the Health and Wellbeing Board. So what we're trying to do is make sure, I'm a clinician by background, and everything comes together better when people work in teams and work in teams effectively. So we know that some of the localities here, in terms of the PCNs, are not quite what we call coterminous. They're not quite mirroring the local authorities, because the local authority has 3 localities as well. And if we go to the next slide, that actually doesn't matter, because you're, as a member of the public, all the things that go on behind the scenes, I guess people are less interested in. What they're interested in, like I am when I'm a patient, is that I can get the care that I need and that my needs are met. So we've been working hard to work with the council localities, and you can see the north is coterminous, i.e. it lines up with the Southport and Formby PCN, but you can see there's a little bit of overlap of the blue lines and the red lines across the 2 localities down the south of the borough. We've worked in localities as a CCG because that's a 30 to 50,000 population. That's not going to go away in the changes, because we believe that that's a useful size to do things and deliver care and make sure that care is delivered with NHS and the wider bodies of community voluntary faith sector locally. And we've been working with our community service colleagues in Merseycare, social workers, nurses, pharmacists, doctors, to develop what we call integrated neighbourhood teams. So those 8 are our ways of delivering care. So planning care, delivering care, and that's what that is trying to signify. So what we need to do is continue, as we do, building up services from the needs of our population. And I don't have to tell you, if you live in Seaforth and Litherland, or you live in the north end of Southport, people's ages, circumstances are very different, and you might need a configuration, a set of services that looks very different in different places, and that's what we're trying to do, is fine-tune so as we can best meet the needs of these localities. Next slide, please. How have we been doing that? So this is a 5-year journey. It's not something that we've just been doing the last 12 months. I haven't got a crystal ball. I'd be a rich woman if I had, but as I say, I've got a few years experience, and we focused 5 years ago on a transformation programme in Sefton to start to think about how we work with GPs, and then they became primary care networks, how we brought providers together, and therefore the Provider Alliance was developed, how we as a CCG, that's a commissioning organisation, we don't deliver services, although we do have medicines management that supports delivery of services, but in the main we are a commissioning organisation. How we work with the local authority, we also do a lot of commissioning, and rather than everybody telling the story twice, 3 times, 4 times, how we could perhaps streamline that. So we've been doing a lot of work in that commissioning, integrated commissioning space. And then finally the acute and specialist services, which for us is both our Luft, so Liverpool University Foundation Trust down at Aintree, and our Southport and Ormskirk Trust, and then we commission services from the Women's, from Alderhay, from the Walton Centre, and Liverpool Heart and Chest. So those services are really crucial, as you just heard in the performance and the answer to that question, to make sure that when you need care, we can get you into the right place of care the right time, first time. So particularly for us, we've got quite a bit of challenge in terms of our acute services at Southport, and therefore the Integrated Care Board at Cheshire and Mersey might have more of a role with acute and specialist services, but what we've got to absolutely be clear of in the place, working with them, is to make sure that services are arranged to meet the needs of our population. So we've got a whole programme which Ken and I have been exchanging emails about in the chat box in terms of shaping care together up at the Southport end. And all of that is trying to make sure we come together and we spend the Sefton pound wisely. Moving on. So I've not gone mad. This is an upside down triangle, and it's meant to be an upside down triangle because it's not about Cheshire and Mersey. It's about what happens down in the communities or our neighbourhoods in Sefton and the work we do at that 30 to 50,000. They're arbitrary figures, 80-20. But what I'm trying to say here is in the borough of Sefton and in the 3 localities that are called Community First with the local authority and our 3 PCNs and 8 neighbourhoods, the majority of the work 1st of April, post the 1st of April, albeit it will have oversight with Cheshire and Mersey, the arrangements that we are hoping to put in place in Sefton will bring the majority of that working out, if you like, an understanding of need down at a very local level in Sefton. And that's the development of an integrated care partnership, or as they're now called, place-based partnerships. So, you know, what I'd like to assure everybody is it's been 9 years of the CCG. This is our last few months. We haven't taken the foot off the gas. Even in the brave new world, the focus will be Sefton and right down into the neighbourhoods and communities in which you live and maybe work. The PCNs have got a pivotal role in the future. Sefton will be a place-based partnership. It is important for people to understand reforms, particularly these reforms that are trying to glue back a lot of 2012, where there was significant fragmentation. The way in which we're doing that is through our integration agenda. And the example I'd give on this one, sort of at Cheshire and Mersey, would be we've got huge workforce challenges and there's some really specialised areas. Mental health in subsetting in mental health is a good one. And if we did it once, we might attract high caliber people that could deliver care for and on behalf of patients across Cheshire and Mersey. Sometimes when you try and dissect that right down into 2 CCGs in Sefton, it's much more difficult to attract. So there are some really good reasons why you would want to aggregate up, but they will be limited compared to what we're trying to contain consistently within the borough of Sefton. It's been my privilege to be able to serve in the CCG as the accountable officer, and my role actually disappears in April because there will be all the 9 CCGs will be subsumed up into the Integrated Care Board. The functions will be up there, and therefore, just to reinforce, it is my absolute intention to continue until midnight on the 31st of March to ensure that the communities in Sefton continue to have the services that they need, and it's been my privilege to serve you all. I think that might be my last slide. So I'm going to ask if there's any questions in that space. Thank you.
Okay, thank you, Fiona. Does anyone have any questions for Fiona before we move on? Okay, no. So if we move on to the next slide and our next speaker, we've got Ella Milton from Sefton Council to talk about the future of health and care. So thank you, Ali.
Thanks, everyone. Hello, good evening, everybody. Hi. So just, I think a lovely colleague is going to load my slides for me. Thanks very much, Jonathan. But yes, hi, my name's Eleanor Moulton. My role is Integrated Social Care and Health Manager at Sefton Council, and I've got some slides to take you through some of the things we've referenced this evening around the policy changes around the delivery of health and care and what that means for Sefton. So thanks very much for joining me tonight. So I wanted to start just before I move on to the next slide of whether I could put a question back to you all, and if you could please post your answers in the chat. I wondered if people present would like to have a go at guessing how much you think we spend as CCG and Sefton Council combined spend on health services and adult social care services caring for people in Sefton each year. So if I just pause there, if colleagues wanted to have a guess in the chat, that would be really helpful. My only issue being I can't see the chat on my team. Something's going a bit funny on my team. So if I could ask a colleague just to give an indication of the sorts of guesses people are giving, that would be really helpful.
Jamie, do you want to do that?
350 million, higher, 650 million, higher or lower?
In fact, it's a bit higher than even the highest figure there. If anyone wants to have a thank you very much, Jonathan. So in fact, we have a combined yearly spend of that figure you see in front of you, which is a huge 748 million. So to put that in context, that's actually double the net spend on transfers of Liverpool and Everton football clubs combined over the last 5 years. So I think that really does put it in context and really demonstrates the need in Sefton, but also the opportunity we have on the table right now to make a really big difference with spending that money differently and planning how we spend that money differently. So thank you. Next slide, please, Jonathan. So integration is an idea that's been around for a long time. The principle being it will make things easier for the person who needs care and support if they only have to tell their story once. If it doesn't matter which door they go through, that they'll always get everything that they need. Hopefully it stops things being done twice and costs less money if it's done in the simplest and most straightforward way, with everyone working together to do the best they can for the person in front of them. The Health and Care Bill currently going through Parliament will support this long-term aim with changes in legislation that supports integration of health and care services. Thanks, Jonathan. As Fiona referenced, the Health and Social Care Bill was published in July of this year, and it introduced some changes in terminology. So this diagram represents how integration will look, with England as a whole split into integrated care systems, ours being Cheshire and Merseyside Health and Care Partnership. And this partnership overall contains place-based partnerships. So that's everyone that works in Sefton for the NHS or social care. There will be integrated care boards, and they will decide on things which stay just in the NHS for Cheshire and Merseyside. There'll be integrated care partnerships, which will organise things and work with the place-based partnerships to try and get the best offer for Sefton as one of the 9 places that exist in Cheshire and Merseyside. And there'll also be provider collaboratives. So this is NHS trusts working together on big footprints around things they do well. So for example, specialised mental health. It's important to note this isn't fully decided and still an emerging piece of the health and care bill jigsaw. Thanks, Jonathan. If I could have the next slide, please. So what does this mean in Sefton? So these 2 graphics try to illustrate exactly what place-based partnerships mean in Sefton. So a place-based partnership as locally you might hear referred to, or might have heard referred to a Sefton Integrated Care Partnership, is a collaboration of planners and providers across health, local authority and the wider community who take a collective responsibility for improving the health and well-being of residents within a place, the place being Sefton. So it's focused on all age service provision. So it's working together to simplify and modernise care and implement service models which deliver improved outcomes. So that's straight from the beginning of life all the way to the end of life. It includes public health and wider community development, and should include community-based wellbeing offers which it might include social prescribing activities, includes the voluntary care, faith and social enterprise sector, and local access to green space and leisure facilities, one of our big assets in Sefton. It includes our GPs and wider primary care delivered through primary care networks that you'll be familiar with, includes community mental health, includes some urgent and emergency care, including physical and mental health, although some of that will be part of that Cheshire and Merseyside system. And it will include the ongoing management of long-term conditions, including the use of skills, expertise and resources that have historically been accessed via referral to acute care services. And it, of course, it includes social care, education, housing, employment and training support. Thanks, Jonathan. Next slide, please. So the question is, what will be different in Sefton? So we are now being asked to think of ourselves as one team and focus on what people really need, and to forget about barriers like different organisations or doing things separately without thinking about things together as a whole. And we need to do this as part of our jobs every single day and with the public. This will use the best of what we have available to us. Now things might have to go through 2 or 3 separate sets of meetings to decide things, and in the future we'll be able to get them done faster by there being one big meeting that everybody makes those key decisions together. So we will also put our money together in a pooled budget, which will help us get the best out of it and get the most out of it. It's important to say, though, it doesn't change what people in Sefton need. It changes the way that health and care do something about it. So the next slide explains that we already know what has to be done, and we're already familiar with the health and wellbeing strategy and the local NHS 5-year plan, Sefton Together. Thank you. Next slide, please, Jonathan. So this slide is a visual of the plan on the page for the health and wellbeing strategy, Living Well in Sefton, which runs from 2020 to 2025. So work is already underway to deliver a single set of combined health and wellbeing strategy and Sefton Together priorities and the indicators to go with those that tells us that we're making a difference. So it's really important to emphasise that current work builds on what has already been done with the people of Sefton to identify what they need and want from health and social care. It's not reinventing that bit. Next slide, please, Jonathan. The next visual illustrates the things we know we are doing well at, or we're doing worse at on a compared to national levels and compared to comparator areas. And as you can see, we do have a clear picture of what we need to do across the whole of the life course. So again, this is about reassuring people that we know what needs to be done. This is about doing things differently to try and impact on those things. Thanks, Jonathan. Next slide. So again, the next slides will be familiar to most people on the call. This is just the visual ambitions contained within Sefton Together. Let's give you a moment to refresh yourselves on those. Again, I hope it illustrates to you that it doesn't change these things that we all know and we're all committed to working to, but gives us the chance to pull together to deliver against them. Thanks, Jonathan. Next slide, please. And this slide is a continuation of those priorities again. You will be familiar with them and they are informed by engagement with people of Sefton. Thank you. Next slide, please, Jonathan. So this slide explains some of our current priorities. So we need to keep on working to develop the Sefton Integrated Care Partnership, or the local place-based partnership, quickly, so that we're ready for when the bill becomes law in April 2022. This will enable us to show that we are ready and we know what we're going to do, so that the government feel able to trust us with that extra money and responsibility. We need to make sure that we use information we find from engaging with communities and through looking at our health and care data to involve communities and their information in how we manage the health of the borough. We need to work together to create a culture, principles and place plan for Sefton that delivers on the health and wellbeing strategy and Sefton Together, and we need to start testing this plan out. So in terms of people's health, our priority is to help people as early as possible, or by giving them the tools to help prevent ill health. Thanks, Jonathan. Next slide, please. So a good example of how we've already worked in this way is our care home forum. So the care home forum during COVID was a group of people who came together from hospitals, district nurses, GPs, all different people from across the council and CCG. We met every day and we saw what was happening in care homes and thought about what we could do to help. Then whoever was best to deliver that help did the thing that would help the most. We didn't think about the rules of who has a contract to do it or whether their boss had asked them to do it. It was just about doing the right thing. And we changed so much. I think some of the key highlights to pull out is we helped with the rollout of vaccinations really, really quickly. We're really proud that we vaccinated the highest number of care home residents and staff in Cheshire and Merseyside, and we continue to work to get that figure going up all the time, and we're about to prepare for the booster programme that will follow. We made sure that all of our care homes had enough PPE and had a continual supply when that was nationally a really big challenge. We helped care homes to find more staff when they had continuity problems, when a lot of people were off sick, for example. And we helped to get the right medication into care homes to support the new challenges that they were facing during the pandemic. We worked hard to make sure we got visitors back into care homes safely. And all of this work has really taught us the blueprint, really, for what we mean when we talk about acting as one, aligning the way we deliver things. It's led to a commitment to keep working together like this. And so, for example, we now have an integrated care home strategy, which will be approved at Health and Wellbeing Board in the next few weeks, which sets out what we will do collectively to make sure we're getting the best quality from our care homes, we're getting the best value for money, our staff and workforce are skilled and happy in their career and able to continue that career. So we're really excited about what we can achieve through that. Thanks, Jonathan. Next slide, please. So the next slide is to introduce to you the second poll of this evening, which should be appearing on your screens and will also be available in the chat box for you to select what best matches your view. So the questions are, do you think that Sefton organisations working closer together will improve services locally? And do you feel that these proposals align with our local plans, Sefton Together and Living Well Sefton? Thank you. Thanks, everyone. So finally, just to finish my section of the agenda, any questions? So please post your questions in the chat or raise your hand for the chair to call your name. And happy to provide any extra information that's helpful. Thanks very much for listening.
Thank you for that, Ellie. Any questions from anybody on that presentation? Okay, great, thank you. We'll move on to the next item on our agenda. Say, Mr. Syme, I think you've knocked your video on by mistake, so if you wouldn't mind just switching that off if you can. Don't worry if not. Okay, next item is an item on general practice, which Jan Leonard, who's our Director of Place for the CCG, is going to start, and then I've got a couple of slides myself as a GP. So if I'll hand over to Jan.
John might have a problem
Struggling
getting a mute
on
button
mute there.
Maybe one of our team can try and help John there.
Just see if I can unmute Jan here.
Don't you just love technology?
I can't.
Let's have a look.
Okay.
I can't. I wonder if you
No,
need to leave and come
yours.
back, Dan. I'm not sure what's happened.
I'll just give Jan a second to log out and back in again.
Yeah. These technical things are sent to Triage. I don't know of our colleagues that have joined us. Jan looks like she's sometimes the whole thing freezes
Going
and
so well.
you
Wasn't it?
can't get out of the you can't get in, you can't get out. So the other week at a meeting I provided a musical interlude, but I'm not going to suggest we do that today. So Dan will be trying to leave because I can see that her screen is frozen there. So just apologies while we get Jan in.
I'm here.
All right.
Welcome back.
I'm here and you can hear me. That's great.
Yep.
Sorry about that. I just couldn't unmute myself, which sometimes happens. So thank you very much. Apologies for the delay there. So I'm going to talk to you about general practice in Southport and Formby. If you could go on to the next slide, please. So during the last, well, I think 18 months, we've faced significant challenges, not least keeping our patients safe, keeping you safe when you're coming to visit your GP, but also keeping our staff safe in practice as well. We've seen a huge rise in demand for appointments and access to GPs. You can just see some of the numbers on screen there in the slide about the number of contacts that practices are handling, whether it's through phone calls, face-to-face appointments, and video appointments. And when Ellie was talking about the work we did to support care homes, video appointments was enormously helpful for our care homes during the pandemic, because it meant there was less teams going into a care home to visit a patient, yet they could make an assessment safely. And I think it's safe to say our practices have been they're busier now than they've ever been, and that's not before we even look at the COVID vaccination programme. Next slide, please. So what have we been doing? So at the start of the pandemic, we set up some COVID hubs. So these were hubs that were dedicated to see patients who needed to be seen face-to-face with either suspected COVID symptoms or respiratory symptoms. And we set them up and they saw patients from all our practices in Southport and Formby. Our practices worked so hard to get the vaccination programme up and running. We had 2 sites, one in Southport and one in Ainsdale, and the scale of work required to call patients, to recall them and to get those vaccinations in, it was just phenomenal in terms of lots of back office and admin support in delivering that programme. And at the very end, I will talk about the booster programme. We increased the number of home visits that were available, and again we got a specialist visiting service in to support us doing that. So again, might not have been a usual practice that came out to see you, but it was a dedicated team. And again, that was to keep patients and staff safe and to make best use of that capacity. The infection prevention control measures have been a challenge. As you'll be aware, most of our practices are in converted houses. They don't have big waiting rooms. It was very difficult to put a one-way system in place to enable patients to socially distance in them. And that's why face-to-face appointments have been when they've been clinically needed. And that's to keep everybody safe. You have to appreciate if there was an outbreak, particularly before we saw the changes to the isolation rules, the quarantine rules, you could take a small practice out if you had a number of staff that had to self-isolate, and that's why these measures were necessary. And then triage, which is often much maligned, which is really about telling somebody what you want to be seen for and getting you to see the right person at the right time. We've got a huge range of professionals now in practice. We have clinical pharmacists, we have a range of nursing staff, we've got physiotherapists, and this is about making sure that you see the right person first time and only need to tell your tale once. Thank you. And we know these changes, if you could, next slide, thanks. These changes have been difficult for people to understand, they've been difficult for people to accept. And so we are aware that people have been complaining that there's a perception that practices aren't open. But just some good news, because I think it is worth recognising this. So there's a national survey done every year by Ipsos Mori. And so the patients were polled earlier in the year from January till March. And from that survey, 88% of Southport and Formby patients, which is above the national average, were satisfied with the care they received. And in fact, Southport and Formby practices were the 7th highest in the country, in England. So I think that's something that we really ought to, be proud of, in a way, that we have got really good practices in Southport and Formby. Some other figures there that patients found a good experience making an appointment. I think 91% of the time patients felt listened to and treated with care and concern. That's really important. And then another one that we haven't got on this slide, but I think again is worth mentioning, is around 91% felt that the receptionists were helpful in their practice. And our reception staff are the ones that often bear the brunt of complaints. And I think we have to appreciate, that they're going in, day out, and doing a really difficult job. But it is good to think that they are being appreciated. Next slide, please. So some of the things we are hearing is you can't call into reception anymore. And I think that is starting to change. And that was for the reasons I've explained around infection prevention control, keeping staff and patients safe. The other one is that there are no face-to-face appointments. All our practices are offering face-to-face appointments where it's clinically necessary. E-consult, it's a bit like Marmite. You either love it or you hate it. And that's where you can book a consultation online or ask for some admin functions online. It's amazing in terms, some people love it because they can do it when it's convenient to them. If they've got something they perhaps are embarrassed talking to somebody about, they can do it online. But again, it's not for everybody. And then some people only want to see a GP. And again, I've talked about sort of the range of professionals that are in a practice. And I think, and Rob's going to expand on this a bit more now, what sometimes isn't appreciated about our practices is the range of work that's going on behind the scenes. So all the prescriptions that are being done, the blood tests that they're managing, correspondence from the hospital, from our community service colleagues, and that's all going on behind the scenes here, as well as that face-to-face or the consultations that are coming in. So we're aware of some of these issues, and we're going to do some breakout work in a minute after we've heard from Rob and hear your views about how people have found this, because what we want to get out of this is to try and understand for individual practices, what balance is right for you. What percentage of your patients like face-to-face consultations, how many like the online consultations, and try and get that balance right. So I think now, are we handing over to Rob? I'm scared to mute myself in case I can't unmute, but I'll risk it.
Okay, thank you, Jan. So yes, I just wanted to go through a typical day in the life of a GP. And on this occasion, it's this GP, me, and it's last Friday. So this was my day last Friday. My practice is a small practice. We've got 2,800 patients in Southport, and I was in practice with an advanced nurse clinician who was also seeing patients and taking phone calls. So 8 o'clock is when I generally arrive and log in. And there will have been things that have come in overnight, medication requests online, lab results sent electronically, and some admin, and sometimes things that just didn't get done the day before. So an hour generally is an hour on Friday. This is fairly typical for a Friday, is spent doing that. We then do telephone triage appointments. In my practice, we tend to do those in the morning. Different practices will structure their days differently, but I think the activity, when you look at it and separate it, will be much the same proportionally. So there are 20 telephone calls. Not all of those were strictly triage. Some patients can actually be treated. We call it hear and treat. So you can actually resolve the matter over the phone, and there's no more action needed. That might be a prescription or a referral or advice, whatever it might be. That's most of the morning, 20 of those, and then all of the morning, in fact, from in the afternoon, there's face-to-face appointments. So these will either be patients who I've spoken to in the morning who need seeing to be examined, or there might be patients who have communication issues and can't engage on the telephone or by video. There might be patients with learning difficulties, again, who just need to be seen face-to-face because other ways aren't appropriate for them. might be patients who a colleague and a nurse clinician has seen and wants a GP to see and give an opinion on. So on Friday there were 10 of those, and then in the late afternoon, evening, e-consultations, Jan's just mentioned, it was a light day for those. There is no limit on the number of these that can come into a practice. We can't switch them off and we can't cap them. So if on a day 10 patients put in an e-consultation, then 10 come through and need dealing with. And that can be a very straightforward request for a prescription that we're happy to do, or it can be symptoms that need to be seen face to face or anything in between. We then move on to the things that aren't planned into an appointment slot. So some of this is the kind of the hidden stuff that GPs are doing when they're not seeing patients who have rang that day or rang and booked a pre-bookable appointment. So in my practice, we call them extra activity, and there's an area on our computer system, and they're anything really that patients have either rang or colleagues have rang from the hospital, or anybody's contacted us either by phone or by email or by letter. Questions about medications, questions about referrals, patients who couldn't get an appointment because we were full but wanted a message putting through to the GP to have a look at. So 17 of those, with a variety. Some of them take a minute, some of them you ring the patient, you might need to see them face to face, so it's variable, but on Friday it was a couple of hours. And then the evening was spent doing prescription requests, lab reports and documents. So again, it's the stuff that practices and GPs and clinical colleagues are all doing. Prescription requests come electronically and they all have to be looked at. We have to know that that prescription is appropriate, that it's due, that there aren't any blood tests that might need doing to safely continue a medication, that there's no medication dose changes that we need. And sometimes patients will put queries about their prescriptions on that request that we need to deal with. Lab results are very much the same. So we need to know what action we're going to take. You sometimes need to look in the records. You sometimes need to either arrange further tests or speak to the patient or arrange for them to be seen and examined based on the results. And then we've got documents which can be from secondary care hospital colleagues, they can be from patients themselves, they can be from family members, they can be from social work colleagues, so anyone that's written to us. And again, that can lead to further work. So it might need another test in a month. It might need another referral making. It might need the patient to be contacted if it's a serious diagnosis and we need to talk that through with them, or there are questions raised by the letter. So some of them very quick to deal with. Some of them can take 10, 15 more minutes. So as a day, that's fairly typical for a Friday. There aren't really any breaks in that. There's the odd comfort break and the odd chance to drink a coffee, which my amazing reception team keep me stocked up in. But there's no lunch. Lunch is a sandwich while you're clicking away at something else. And it's all equally important. All of these things need to be done properly. There's risk and potential for any of that activity to go wrong. It's not just making mistakes and giving your best when you're seeing or speaking to a patient. Every prescription request has to be done properly because the consequences are profound if you make mistakes with some medications or miss an important lab test result. Other things that we have to do as GPs, which I didn't do any of on Friday because it was quite hectic. We need to manage the practices. Every practice is a business in its own right. We need to speak to our practice managers. We need to look at things like audit. We need to plan, what the practice is doing going forwards. We need to discuss, particularly at the moment, how we're changing the way we structure our days to keep up with demand, but try and manage our time. We've also got other staff that need support. We've got clinical staff that need clinical support, but we've got reception staff who are doing an incredible job at the moment, but are very, very pressured, and unfortunately from some quarters are getting quite a lot of abuse as well. So we've got to make sure they're okay. all of that takes time. So the idea of that was just to give a flavour of what we do, and some of the stuff that sometimes isn't seen, in terms of the things we're doing in the background. My time is up now, and we're going to go into the breakout sessions. What I would say, just as a final point, when you sometimes hear that more and more GPs are working part-time, sometimes in a bit of an accusatory way in the media, this would be considered one day. So a GP working 3 days a week would be considered a part-time GP doing 3 of these days, which is actually full-time hours and then some. So very few GPs now work 5 days a week because of the intensity. But if you break it down and look at the hours, sometimes it's certainly not part-time. And I'll leave people with that thought. I think we had a couple of questions, did we, Jan, that we could maybe pick up here?
Yep, we did. So one was around face-to-face appointments, and I've covered that in the presentation, and we can explore that further in the breakout. And then the other one is about boosters, and I'll pick that up at the end of my presentation. And did we want to do it? I think, are we going to do the breakout and then do questions at the end? I'm looking to someone, Jonathan, to give me a yes or no about that. I think
that would be wise, Jan.
Okay.
Yeah,
So let's do the go into breakouts, give people an opportunity to talk. Yeah.
Okay. So you should be automatically transferred to a breakout room now. If it doesn't happen, if you just leave the meeting and then come back in, and Fran will be there waiting to scoop anyone up, and she'll pop you in a room. So sit tight, and you'll be in a room with a facilitator, and they'll lead you through the breakout. So I'll let the comms team do their magic to transfer us. So I'm going to go and ask each of the facilitators from the rooms just to give us a sort of something positive that was shared, and something perhaps that could be improved, or one of the themes from each room. So if I could ask Suzanne, if you could share from your room. I know you had a bit of difficulty getting into your room, but hopefully you made it.
Yeah, I got in there eventually. So I would say overall very positive discussion in our room. People having to adapt to different ways of accessing. People had a positive experience of accessing other services such as community pharmacy. A lot of discussion around triage, sort of where it worked well, and some challenges and concerns about triage. It was quite useful having Dr. Caldwell in the room for that, but maybe that's something we need to look at in the future, is supporting patients to understand how triage can work to the benefit for patients and the health service.
Great, thanks, Suzanne. Tracy, if I could ask you for your feedback.
Yes, thanks, Jan. Again, some very positive experiences, both of general practice and other services, such as the home visiting service and A&E and physio services online. I think the biggest concern really was for those members of the population who really find digital access difficult. So maybe more elderly residents, and maybe others that have financial barriers or space barriers for finding time to have a sort of private consultation in an area. So I think although our group had very pleased with some of the virtual methods, and really felt that maybe a mixed methodology would be good going forward, it was the concern for those cohorts that really do need a face-to-face or a different type of approach to enable them to get equal access to services.
Okay, that's great, thank you. Claire?
Sorry, just trying to get myself off mute then, apologies. Yeah, our group was, we did have a patient representative, but we did have a lot of NHS colleagues, so probably had a little bit of a different flavour to our discussions. But I think in general, there was a sort of positive feel around, having contact with primary care recently, and also the benefits of using technology as well, and the ease and the ways in which we can use that when you've got busy working lives. I think there was a lot around needing to tell patients more on our residents about the services that are out there, explaining more about our practice teams and how much how they can be help people in different ways, but nothing detrimental to GPs. So yeah, overall some positive and useful discussions.
Great, thanks Claire. And then Jane.
Yeah, in our group we found the positive things was that the experience of accessing the GPs over the last year has been really positive. The question around has the presentation changed your views? The answer was no, because they already realised, how much and appreciated the hard work that goes on. So that was quite positive to feedback. There was talk a little bit around the pharmacy and the community being really well and accessed well. I think the appreciation for the lack of GPs generally and the hard work that they do. So perhaps getting a greater emphasis on prevention of illnesses and things like that for people, and taking that out to the wider public so that they understand the pressures that general practice are under. I don't, Cossie, did you? I couldn't hear your last comments just as we closed down. Did you want to come in around the home visits?
Yeah, just for balance, I wanted to add that there were comments about the home visiting service for the nursing homes. That's very patchy, and people don't get the timely assessment. And we had some issues around people visiting palliative care patients at home who don't know the patient very well.
Okay, thanks for that. And all the feedback will be collated, and we can look at some of the themes. In my group, again, very similar comments that have been shared already. So positive experience of accessing practices in the last year. And in terms of things to improve, really just a bit about who are the members of the team, what skills have they got, and really lots about communication and being able to tell patients how they can access services and the routes in and out. So I think there is some really valuable feedback there that we can take and work on. So that was our breakout sessions. I think I've got another slide now. Thanks, Jonathan. So going forward, so there's talk of a blended model to be able to manage demand. So I've said that demand's gone up, and we're seeing much more access than we did before the pandemic, and the blended model is about how we continue with digital methods that are available and convenient, but we also balance that with a face-to-face offer and meet the needs. And again, one of the things we've talked about is people who can't access things online, and we've got to make sure that our services are accessible to all. So there's work we're going to do on that. Triage will still be needed, and perhaps more so about making sure you get to the right person. And as we expand our practice teams with other disciplines coming in, it is making sure that you get to the right person, and it doesn't just create another step in your pathway. We get you to the right person the first time. And then we are going to be carrying out a survey with our practices very soon, and that will ask you, I suppose in a way you've all been guinea pigs here today, so it will ask you a lot of the questions we've asked you now, and then we'll get that feedback, and then each practice can look at their feedback and work with their patient participation group to understand about what their patients, what's right for their patients, and how we can structure services, within the resources that we've got to meet the needs. So if you look out for that, you'll see that coming soon from your practice. So we have the next slide. Thanks. So lastly, I said I'd mention boosters. So just a plug for the COVID vaccination programme. So we've done a huge job in terms of getting people vaccinated to the point we're at now. We are about to start our booster programme. I think you'll see it starts next week. Patients will be invited, but it will be 6 months after your second dose. So don't think it's from your first dose and I'm due because I'm in this eligible group. You'll be called and it will be 6 months. So just have a check on your calendar and see when your second dose was, your second vaccine, and it will be 6 months from that. If you're one of the people who sat there thinking, well, I didn't go first time, am I too late? No, the offer is still there. So if you haven't had a first vaccine and you feel you want it, there'll be plenty of opportunity for you to access that. So in Southport, we'll be running the clinics at Southport Centre for Health and Wellbeing. Again, some of you might have been vaccinated there. And we've also got our community pharmacy offer available, and that you'll be able to book in there as well. It's probably unlikely you'll get flu at your flu jab at the same time. And again, I will say, if you get invited for a flu jab, please take up that offer. We've seen in the press about how the NHS and our hospitals are under enormous pressure. Let's not put any more pressure on them with flu. So if you get invited, get both jabs if you're invited for them. But it's likely that you'll have them separately, just the logistics, you know, of trying to coordinate those. But do take up the offer when you can. And I think that was everything. And we've had lots of inquiries about the vaccination programme, and we're still here and we will answer any questions on that. And now my last slide is any questions. So if you want to, I think we've got a few minutes. I think Jeff had asked a couple of questions. Hopefully I've answered them, but if not, feel free to come back. And if anyone else has got any, if you put your hand up or pop it in the chat box, we've got a few minutes.
Jan, there was a Jan who wanted to ask a question just before. Jan Sterling put her hand up just before we went into breakout. Don't know if she's if her question got answered in breakout.
I'll give you, Jan, the answer to maybe unmute yourself and ask your question.
Hello, I think I put all the questions that which I needed an answer. I think you did say that you would come back to me on some of the issues that I've raised.
Okay, I'm guessing we've captured them in the chat box then, and we'll work through those and we can get you a response back. That's
okay,
fine.
Let me go through that. Thank you.
Okay, I can see Denise has got her hand up. Do you want to ask a question?
Yeah. Is there a shortage of flu vaccine at the moment? Some people have been asking me, is there a shortage of the vaccine? When are they going to have their jab? And some people have had their appointments cancelled. I'm assuming because I've read in the press there's a shortage at the moment. So over to you.
I might ask Suzanne, our Head of Medicines Management, to answer that.
Hi, Dan. No, I'm not aware of any problems at the moment. The vaccinations tend to come in around now to community pharmacy and general practice, and the deliveries are quite staggered, which is normal. I see that Rob's got his hand up as well.
Yeah, there isn't a shortage. What's happened is the provider who provides the vast majority of GP practice vaccines is having some issues with freight and border crossings and that sort of thing.
Oh.
So what they did was they have contacted all GPs who had delivery dates at the beginning of September, and they've put those back by 1 to 2 weeks. So we are still getting the same amount of vaccine. It's just a couple of weeks later than we thought, and a lot of practices, my own included, had already booked on the basis of that first date. So we've had to cancel patients and reassure them that there is still a vaccine with your name on it. It's just going to be a couple of weeks. So no shortages, just a small delay because of the suppliers' issues.
Thank you very much, Rob.
I think that probably answers Anne Doring's question in the chat box, Anne. Can I just ask, sorry, I'm not coming on camera because the two of you are. Can I just ask, have we captured Jan Sterling's questions in one of the groups, or Jan, is it something you want to put in the chat box, or is it a conversation you want to have separately? We'll just bear with us. Jan, what do you want to do?
Well, I think the question I asked was quite complex, and I think perhaps it would be useful if it could be considered, and then I could be given a response.
Okay, so we'll need to make sure when everybody starts floating off at the end, if you just stay on and one of the team will make sure we've captured the complexity of what you're asking, and then we'll go away and get a response. Jan, is that okay?
That's lovely, thank you.
No worries.
Now I can see Denise, you've still got your hand up. Is that another question or is it a legacy hand? Okay.
Sorry. No, I haven't got another question.
Oh,
Okay.
sorry, I couldn't quite hear you then. Did you say you had, if you've got another question, go ahead and ask.
No. I
No.
just didn't know how to put my hand off. Thank you.
Don't worry, that's fine. In that case, I think I'll hand back over then. I think we're done. Thank you all for your participation.
Thank you.
Okay, thank you everybody for that. That was a really good discussion. So we have a closing poll for you again. Those that can't see the poll, please put in the chat box and we will capture your results. Okay, and it's a straightforward yes or no. After today's event, do you feel you've had a chance to have your views heard?
There's a box. Yes.
Okay, and then the next poll for anyone that can't see it. After the discussions on GP access, do you have a better understanding of the way practices are working and how to access them? That's yes, no, or unsure. Okay, and the next one, in future, would you prefer virtual or face-to-face events? And that's virtual, face-to-face, or don't mind as the options. Okay, next one, what time of day suits you best for this kind of event? Morning, afternoon, or evening? And another one coming thick and fast. Would you recommend coming along to a big chat event to a friend, colleague, or member of your family? The options are yes, no, or not sure. Okay, I think that's all of the polls. So hopefully everyone's had the chance to submit their votes. So just to end with, we have a video to watch, and then I'll just close with a few words after that. So move on to the video. Okay, so just to close the event, thank you everybody for your time and coming, and thank you for all the input in the questions and in the chat and in the breakout groups. It sounds like there was some really good discussions there. And a lot for us to take away, and certainly my group there was. So our annual report and accounts are available on the website, among other information about us as a CCG. And if there are any questions that you haven't had a chance to answer, or you think of later, the web address is communications@sefton.nhs.uk. Pop them in there and we will absolutely get back to you with a response. Thanks again, everyone. Good night.
Thank you.